The Department of Health has welcomed the new year with a baby boom across the country's public health facilities. A total of 1,669 babies were safely delivered on New Year's Day 2026, marking a significant increase from last year's figures. One of the first babies of the year was born just after midnight at Mowbray Maternity Hospital in the Western Cape. To speak more on this, let's now welcome Health Department Spokesperson Mohale. Foster, a very good afternoon to you and a Happy New Year to you.
Good afternoon to you, Unati, and good afternoon to your viewers, and compliments of the new year to you and all the viewers of SABC.
Thank you so much. Now, the joy of welcoming babies every year, I mean, whilst it's still a significant event, Foster, has unfortunately been overshadowed by just the level of teenage pregnancies that we are seeing. How many of the almost 1,670 babies that were born this year are by young girls?
Yeah, no, you're absolutely correct. Every year we, not only on Christmas and New Year, that we record this new bundles of joy and teenage pregnancy. We record this on a daily basis, on a monthly basis, a quarterly basis at our public health facilities. Of course, this year the number has slightly increased, especially on New Year. Last year we recorded just over 80 teenage mothers, and last year the youngest mother was 12-year-old from Eastern Cape, followed by a 13-year-old from Limpopo province. This year the youngest mother is 15 years old. But that's still a concern for us. You can imagine a young girl as young as 15 years old. It means that child got pregnant at the age of 14. You can think about the future of that child. So that is a concern for us as the Department of Health. And we strongly also believe that that should also be a concern for families, communities, but also for the entire society.
And just staying on that, Foster, what are some of the mechanisms that immediately kick in when a child of that age comes into a hospital and is confronted by a healthcare provider? What are some of the steps that are taken by the department, given the fact that it could be a number of reasons, and on the top of that list, it could be rape?
Yeah, no, definitely. Remember, we come across this pregnancy as soon as these young children test positive for pregnancy at our facilities. So that's where the journey of antenatal care begins. But what our healthcare workers, they do, working closely with other departments like your Department of Social Development, the Southern Police Service, especially for those who are able to disclose those who impregnated them in terms of age and the relationship, whether it was a consensual, they consented to that sexual activity, whether it's rape. If it's rape, we immediately involve South African Police Service, working with the NPA under the umbrella of Tutuzela Care Center to ensure that as much as we provide support to this young girl, but we also assist this girl to open a case if the person who impregnated this child is older than the child, but also it was a rape. But unfortunately, some of these girls, they don't disclose the age and the type of relationship of those who impregnated them. So that's why we need the support of family members to say, please, let's try to work closely as a society to ensure that we act in the best interest of these children, in case, especially for those who got pregnant as a result of rape, so that we try to send a strong message to those who take advantage of this young girl and impregnate them. Then they need to be arrested. So the sooner or the day we get some of these older men who impregnate this girl arrested is the day we're going to send a strong message to all elderly men, adult men, to say, please, when you see this young girl, don't see a potential wife, don't see a potential girlfriend, because they are destroying the future of these young girls.
Yeah, and I certainly hope that next year, this time when we speak, that will have changed. But let's then look at what currently you are looking at in terms of the deliveries of this year. The 1,669 births that is an increase, as you've been saying, from the previous year. Just give us, just some of the stats. I mean, which provinces produced the most babies? Who in the province actually had the baby come through at midnight? I mean, those are the good news, right, for some mothers.
Yeah, no, definitely. This year on Christmas Day, the first baby was welcomed in the Western Cape, in Cape Town Hospital. I think the first two babies were welcomed in the province of Western Cape. But also we congratulate not only the mothers, but also our healthcare workers who worked tirelessly in order to ensure safe delivery of these bundles of joy. But also we urge these mothers, parents, and families to travel with us in this journey to ensure that we raise this child, we give this child immunization to protect these babies against vaccine preventable disease or childhood diseases in order to ensure that they grow and they develop well. So hence we want to call upon all the parents also to ensure that those children, they get registered with the Department of Home Affairs before they leave the health facilities, especially for those who were born in hospital, because we have got a partnership with the Department of Home Affairs to ensure that all mothers who deliver in the hospitals, they conveniently register the little ones with Home Affairs. They get the birth certificates before they leave the hospitals, because we understand the challenges of going to queue with the general public. So that is very convenient, and we encourage all the parents to take this advantage, take this opportunity to ensure that they don't go through the challenges that they always complain about.
Foster, thank you so much for your time. Really do appreciate it. Foster Mohale is the spokesperson of the Department of Health nationally.